work. But we take responsibility for that, take responsibility for the errors, take responsibility for fixing it. And if we get the website working as we expect we do by the end of this month, then I think we're going to be in a good place.
I want to show something you said just a couple of days before the launch of the website on CNN, talking about how the website was ready to go.
Starting on October 1, people are going to be able to go to these marketplaces online, compare plans. They'll have access to plans they've never had before. And when people see that, they're going to see this is going to be a consumer experience unmatched by anything in government, but also in the private sector.
Clearly didn't turn out that way. I mean, a couple big questions there. And people are still struggling with this. How is it possible? And we've seen all these reports as the president was asking about this website every single day. How is it possible that he and you at top levels of the White House did not know? And given that, why should we believe your confidence now?
Well, I'd say a couple things. One, we did believe that. That was the question. The president asked these questions. Those are the answers he were given. These results do not match up to his expectations, the American people's expectations. It's inexcusable. There is no question about that. Since then, we have made serious changes. We sent Jeff Zients in, who is someone who's a close advisor of this president, someone who has a long history of fixing problems like this in the public and the private sector. He has gone in. So we made management changes. He's brought in a team of technological experts from Silicon Valley and elsewhere who are looking at this. They've done an analysis of what went wrong and how to make it work. And so, you know, he has confidence and we have confidence we can get this done, but it's not easy. It's going to take a lot of work.
One thing that is also clear is that the president's signature promise on health care, if you like your health care plan, you're going to be able to keep it, that is not literally true. It is not true, and the president's taken a lot of heat for that this week. And the Wall Street Journal reported this week that there was actually a lot of debate behind the scenes about whether or not the president should actually make that promise. You see the headline from yesterday's Wall Street Journal right there, and they quote, one former senior administration official said that as the law was being crafted by the White House and lawmakers, some White House policy advisors objected to the breadth of Mr. Obama's Keep Your Plan promise. They were overruled by political aides, the former official said. Is that true?
That is not my recollection at all of that. And let's talk about that promise for a second. If the president didn't intend to keep this promise, why would he have gone out of his way to put a provision in the law that specifically says that if you have a plan before Obamacare passed, you can keep that plan? Now, if your plan has been downgraded or canceled, you can't. But if the president were to allow people to have those plans be downgraded or insurance companies to keep selling bare-bones plans,
knew this was a problem.
But George, if he had done that, he'd be violating an even more important promise to the American people, that everyone would have a guarantee of access to quality, affordable health insurance. It's important to understand who we're talking about and the kind of plans we're talking about. It's 5% of the market is this individual market. 80% of people have health care through Medicare, their employers, or Medicaid. 15% don't have health insurance and now have access to it for the first time. And 5%, if you had your plan and it hasn't been changed or canceled, you can keep it. 50% of this group are going to be able to get access tax subsidies to make their plans cheaper, and most of them will get a better plan for less, for the same or less. And many of these plans were cut rate plans that didn't cover hospitalization, doctor's visits.
Let's stipulate what you just said. Let's assume it's true, but it still doesn't meet the literal promise the president made right there, and your policymakers knew that then. Why didn't the president say during the campaign what he said this week? For the vast majority of people, if you like your health care plan, you can keep it.
Look, I can't go back in time on this, and like I said, I don't recall this debate the Wall Street Journal talks about in any way, shape, or form.
This never came up inside?
Not that I remember, but here's the point, is that if you had a plan before the Affordable Care Act passed and hasn't been changed or canceled, you can keep it. And look, I understand that there's controversy and confusion. This is why the president went out and addressed it in Boston.